Hi Leute, hier ist der Gero. Ich war am Wochenende auf der Opti, das ist die größte deutsche Messe für die Augenoptik. Und da habe ich ein Seminar gegeben rund um die Sklerallinse. Und da internationale Gäste im Seminar waren, habe ich das auf Englisch gehalten. Mein Englisch ist nicht so gut. Man versteht das aber, was ich da erzähle. Und ich werde das Seminar, so wie es war, auch auf Deutsch rausbringen. Jetzt halt auf Englisch. So, I will do the speech now in English. I was at the Opti fair last weekend and I did a seminar about scleral lenses. I did it in English because we had visitors from Czech. And as I will give a seminar in Czech the next month, it was a good training for me. I learned a lot about my presentation style and about my English skills. They are non-existent. So have fun with the video. It's all about scleral lenses, how I fit them, why I fit them, how I came to be a scleral lens fitter. Have fun and give me a comment how you liked the seminar, how you liked the video. Shoot me some questions, and as always, thanks to the equipment sponsors SwissLens and Topcon. And you see everything in the description below. Have fun with the seminar. Bye. Each other. I know you. I now know you. I know you from today. Petra, we have already met and talked. And your husband, right?
My husband, yes. Victor. Yeah.
Victor. Okay, cool. And you are a dentist.
Yeah.
But you still want to learn about sclerals. You want to, or just
no,
company?
just information, but maybe I will start to do it. I didn't want to do it, but still this problem to coordinate it with. So,
okay.
So that's the reason.
I will give you a heads up what happened yesterday, because you were not here. Guillaume introduced many new sclerals. So he showed how to use the Medmont Meridian to get the sagittal chord in 15 millimeters. It's not that the Medmont measures it, but it's mathematically then from 9 millimeters to 15. And I had a patient measured with the Medmont, and I was seeing it yesterday, the sagittal height. It was 4,000. And then I looked at my lens I dispensed to her, and it was the same. So the measurement was in this case correct. He said about 80-90% it's correct, and it helps with the first trial lens. Then he introduced the multifocal scleral lenses.
Can I close the door?
Yeah, sure. Then he introduced the multifocal scleral lenses. They will come.
Okay.
You can order them on Monday.
Okay.
They work center distance, center near, progressive.
Okay.
You can try. It's the same success rate as with any lens. Yeah,
Okay.
he said. So for me, it's around 50%. Then he introduced the quadrant-specific scleral lenses. So when you have asymmetrical scleral lenses from SwissLens, you have 2 dots on it. If you show him the dots, he can do every quadrant specific. It's good for pinguicular.
Mm-hmm.
And he will be able to dispense the bigger lens, he said, by the end of the year. So you can go up to 18 millimeter scleral lenses. That's good for you.
Yeah.
You can use the 15 millimeter as your trial.
Yeah.
And then you tell him, I need the same bigger delia.
Okay.
And since in Germany we have a different with the insurancy, it's a different cost factor. You have a different number.
Okay.
Sure.
Yeah.
Cool, that was the main part of Guillaume yesterday, condensed into 1 minute. Okay, nice. So, I would prefer if we have it bright, if you're able to see anything there. So, why scleral lenses? Why they came to me? What I learned in school when I did my what's it called, optician master, but it's not the real master. You have the real master, right? Good. It's a study. And did you do the normal optician before?
Yes.
3 years? And then
Yes.
you were Meister?
German Meister.
Und dann noch Studium? Cool. And in my 4 years of learning, we just did RGP lenses. RGP lenses, soft lenses, a little bit about keratoconus, a little bit about slit lamp evaluation, and then I started to work in the Uniklinik Frankfurt am Main. And as a preparation for this and the article for Czech magazine, I saw between 2029 and 2015, 30 keratoconus patients every week. Every Thursday we had cornea special consultation hour, and I saw them and I talked to them. I did not fit them lenses. I just did 2 or 3, sometimes 10 fittings per week. So they did not see me as their fitter, so they talked to me about their lens experience. And all the time I cannot wear the lenses, they're very hard. I just wear them for the visit of my doctor or my optician. And I did not know that there were any alternatives until I met SwissLens, and they introduced me to the hydrocone, to the soft keratoconus lens. And that worked wonders. But I was always missing the visual acuity. Like when the keratoconus, I don't have to explain keratoconus today, right? You know it too. When the apex of the keratoconus is centered, the visual acuity with the hydrocones isn't as good. It's better if it's off-center, or if it's a PMD, it's your same experience, right?
Yeah.
Okay. Delia fits a lot of lenses. And so it was not always good for everybody. Then I tried hybrid lenses, hard in the middle, soft skirt, and it was good visual acuity, but I saw a lot of scars. I saw a lot of erosion, I saw a lot of corneal staining. That was a real problem. So I got introduced to Scleral. The company came to me. I will not say the name now, but I'm thankful that you did it, guys. They know who they are. And they came to me because I was working in the clinic. And they know that in the clinic we see a lot of cases. We talk to a lot of patients. Some doctors see 50 patients per day. And even though the patients are pre-measured, they still have to do a lot of stuff, have to think about a lot of stuff, have to think about which operation could be useful, which method could be useful, which diagnosis is it really. And so when patients came to me, they were always eager to learn more about their diagnosis. So what I do today with WhatsApp, Facebook, all the stuff is talking to them about cross-linking, talking to them about their tri-eye evaluation, talking to them about a lot of things, and then the lenses. Like, it's not the lenses first when you work with me. You know it better from your tri-eye patients. Tri-eye consultation, when I did it, we blocked 1 hour per patient. And after 8 hours, I was like, it was too much. It's like a psychological discussion, and always at last comes what I help them with. So, for people who haven't worked in a clinical atmosphere, you work in the doctor now, you had the clinical practice. No. If it's possible now, use your time, if you have time, and look 2 weeks into a uniclinic. It's really interesting the way patients know about their disease, because as we know from Markus Ritzmann, is the guy who made the study, they have knowledge about their disease 15% or 10% of the whole, so no knowledge at all. And the doctors aren't able to help them because it's so many patients. It's like 30, 50 discussions per day per patient. That's not possible. That's not possible. So if you can, do it. we can even look if it's possible in the Uniklinik Frankfurt, if it's good for you. And, oh, that's not possible to see, so we have to darken the room. If you have questions while I'm talking, just ask me. And hopefully, if it gets a little bit... Okay. For YouTube. So, what you could see here, if the light was even better, so this case opened my mind to sclerals. This case, you know it already, Delia, right? Okay. Young patient, 5 years old. And, hallo.
Hallo.
Annette, oder?
Gero.
Setzt euch. Ich rede auf Englisch. Wir haben noch jemand aus Tschechien. Geht das für euch?
Ja, wir probieren das.
Okay, mein Englisch ist sowieso nicht so gut.
Das ist gut.
So, this young, very young patient, 5 years old, has a syndrome which 70 people around the world have it. It's called Riley-Day syndrome, and she feels no pain at all. Like, she had to get her teeth removed because she was biting her fingers. She was biting her limbs, and it's normal that those human beings have a lot of deformations, and they don't grow old. And I'm happy that I'm still in contact with her, and her mother just wrote me because I presented the new Sclerals, and she asked me, is this something for her, and I will see her. And sometimes it's crazy how much experience 5-year-olds have with doctors, so I was able to capture some pictures. She had to get her 5th keratoplastic because of this. It's an ulcus. It's open, it won't heal, no antibiotics, nothing help. I already put a scleral lens on. Why is it possible to put a scleral lens on a 5-year-old girl? Because we need no measurements beforehand. We just need our eyes, a little bit of courage or a lot of courage, and because I was sweating, I was happy that it was dark and she didn't see how sweaty I was. And I was telling the mother, I'm no experienced fitter in sclerals. And she said, yeah, but we have no others, so let's do it together. And placed the child there, and I thought, okay, maybe from the lens and her eye, this could fit, and put it on. And we filled it up with autologous serum made out of the blood of the mother. And I didn't know in that time, there was one case written down in America about this autologous serum and scleral lenses. And I asked the doctor, how much serum? Shall we fill it completely? And he was like, do everything in it, put it in. And it was very expensive at that time. It was nearly 8 years ago. Insurances didn't know anything about it. And we filled it up, put it in, and the mother learned really, really fast. Then I educated the kindergarten how to put it on, remove it. And at that time she wasn't in the kindergarten, it was later. And then she came, and this is after 1 week. It's much smaller on the right side, and she was beginning to see again on the eye. Now, with my experience later, when I prepared this today, I was thinking, oh, maybe I was too flat with the sclera. But at that time, we were all happy that she felt comfortable, she saw much better, and the ulcus was obviously healing. and it healed quite well because this is after 2 weeks. They put her off the transplantation list for her 5th keratoplastic. She was able to see again. She was going to the kindergarten again. She had her first flight with the Scleral. She had her first diving into the swimming pool. It was crazy.
Are you scared about any inflammation?
For sure.
Because there's not that much amount of exchange from the
For sure.
people. How often do they have to clean the lens?
All the time. The mother had to clean it. I advised them to put it out in the day, clean it, fill the serum again, put it on. I saw her weekly. Maybe, I don't know, maybe the mother can tell me if she wants to see it, if she can speak English. Over a period of 6 months, I saw her weekly and the clinic saw her weekly. And it was only because of her eye, and as I told you, the syndrome, she has a lot more. She was only going to doctors around, for sure. You have to, and that's what you can learn in a clinic. I learned from doctors. You have to do a risk-reward assessment with Sclerals all the time. And many people like to do a lot of measurements beforehand to know everything. It's good. We have it too. Like I always get the doctor's paper, I get the tomography, I get everything. And then I fit Sclerals. But with her, the folder was like this. We had one chance. It succeeded, was good, and yes, I'm still thinking about her, about her eyes. When I prepared I thought about, okay, we have to do a refit, and if she wants to, we do it. So why do Sclerals work without measurements? So I like the measurements. I saw the CSP from Oculus, I saw the eaglet eye. I have a lot of non-German speaking patients. I have patients with very dry eyes. I will show you some pictures. So I work with a trial set based on the condition of the eye. I will show you in a minute. And just to know, the scleral lens overlaps the cornea and the limbus, the limbal area. And it lies on the conjunctiva, which lies on the sclera. And you have, when you look at it, several important steps you can start. In the middle, I get the LASIK here. You have to always have clearance at the highest point. Then you have, with this design, to overlap the limbal area. And then you lie on the sclera, conjunctiva, and you want to be as parallel as possible. The evaluation of those things, I've made a video for you, you can see it. And that's how I work. And when I worked with the young lady, I had nothing like this. This is something that Guillaume from SwissLens did, which is amazing for me, because what's standing here needs approximately the sagittal height in the lens of this, approximately. There is no perfection in scleral lens fitting, as there is no perfection in life. I saw popular fitters, I saw how they talk about it, and this here is the possibility to start with a slit lamp, your mind, and the trial set. And I had nothing more with the child. And do you use more than the trial set, slit lamp? No.
No. Actually, I could use the zeros, but I'm not used to it now, and I just.
Ah, you have the OCT?
Yeah.
Okay.
Yeah, but it's more. I'm used to slit lamp and my eyes and yeah.
Good. Okay, so
Experience.
yesterday Guillaume said something interesting to that. That is the SwissLens design. it has limitations. When you have 15 millimeters lens, they have limitations. But now we can further advance it, but in the 3rd or 4th year. So we start slow. You start slowly and you increase everything. And when you start that slow, you get a lot of experience. You can start right away. You can start right away ahead. She was at my seminar. 2 others told me they started the next day with the fit. And here you can see it was in the Corona time, where you were still allowed to wear such masks. Julia did herself. So you fill it up with saline. You can use the EDOs and you can use the bottle. I just read about it again. In America, they don't even say preservative free in 30% of the cases, and they even tell them to rinse it with normal tap water. I don't do that. Tap water is... You can read the scope study. I have prepared it for the seminar. It's a scope study. Schick's dir auch.
Yeah.
And then you apply the lens. And when you have someone with those reflexes like Julia, where she's nearly dead, then no problem at all. No problem at all. And as a fitter, you have to know every 5th patient cancels because they cannot do it themselves. I just had a young couple telling me, we want to do it like the woman in your video. Because she's always rolling around, not able to open it. And I just did, for a doctor, she asked me to write something because of the patient. I got it. The numbers were that, 50% of the fitting in the study were cancelled because of the handling issues. So don't sweat about it. So don't do all your measurements, or maybe you can see when you do the measurements, this will be crazy hard to fit her Scleral lenses. You have to think like this, or you just talk to them. And then you do the evaluation. And I have different slit lamp setups, and I won't miss a digital camera. You have one too, Petra, right? Yeah. It's amazing what colleagues, what friends, what the designer of the lenses can help you with. And then first step is you have put fluorescein under the lens, you put the blue light on, you look if there's any touching. Black would indicate touching. Then you go to a narrower slit, optical slit, you remove all the filters, and then you can see right away how much you are overlapping the cornea with the fluorescein. And you compare it, the thickness of the cornea and the corneal thickness you have when you want with a pentacam, or you use your mind and you know a normal thickness is 550 microns, and with a developing keratoconus, with each stage it gets lower, and with a keratoplastic it gets thicker again. Or you could use the lens, because you know its thickness around 0.3 millimeters, and then you compare it to that. You compare it. Then you look at the sclera, the conjunctiva, and Guillaume wants to have a little bit of movement and a little bit of tear exchange. You see that a little bit of fluorescence here. This means there's a little bit of decentration that you already see. It goes a little bit down. At the Euroscale, we learned that just wait a little bit if it moves. Wait, take your time. Then you see how fast the tear layer breaks up, but it's also because Julia uses a lot of makeup, like a lot. And then you see the makeup everywhere. You have to, I write it down, if they came with makeup or without. I think it's very interesting to come to an eye evaluation with makeup. To all you ladies and men, I had one man with makeup, was also good. And Gladly she didn't came with makeup. 60-year-old and Sjogren syndrome. This was the best pick I could make of her eye. So, maybe, I don't want to be offensive, but I cannot imagine how to do measurements. I really cannot, because that's also the reason why I can't be in a Orthoptics Seeschule with all the babies crying. I have to leave immediately. She has real pain. Like, she doesn't see very good. You see all the scars. You see the tissue is irritated, inflamed, and she's already using a lot of drops. But just for the sake of it, because I did a measurement with the keratograph. 17% of the area was measured. It was for nothing. I don't have the pics because today is not the time to do everything. I fit her sclerals, and I have a pic where she has sclerals on. And I can just tell you, it's a lot more open. And she likes it for an hour. And after an hour, she doesn't like it. Because with eyes as this, when you're seeing Sjogren syndrome, SIGA patients, like I have patients where I see something. There are dry eye patients where you don't see anything and they have pain, and you have patients where you see everything. And sometimes they have no pain, but oftentimes they are very light sensitive and they have pain. And then for them to have 1 hour of quality of life back is good, and oftentimes they have to do it very slowly. 1 hour, 1.5 hours, 2 hours. They have to change their preservative. They have to be really slow advancing their regular wearing time. In this case, I was at the Euroschool and Ms. Fuddle showed, there are patients that have to clean the lens in the daytime. And I was like, no way, I didn't know it, that she's also speaking about it, because I had a patient, she was in my office, this is keratitis filiformis, and she was like, there's something, and I was cleaning her lenses. And now I told her about it, that it could be useful to clean her lenses in the daytime. So when you start with Scleral lenses, what you get? Children, even babies in America. You get dry eye patients, keratoconus, keratoplastic. You get patients who have scars or who have tried everything else and failed. I just uploaded my pics yesterday and I got a lot of questions regarding the new lenses. And I forgot, there's a new material, DK180.
Okay.
Optimum Infinite.
Yeah, okay.
So this is DK100, Optimum Extra. What she's wearing, keratitis filiformis, SwissLens lens, rotational symmetric, 50 millimeter, minus 3.5. She told me she's only able to work with the lenses now. She's wearing in the 2nd or 3rd year, and she's very anxious if the insurance will cover it, but they will cover it, they have to cover it, and she's pretty happy. She's wearing it every day. And what you have to know with keratitis filiformis, if this was not on the lens, it would be on her eye. And then inflammation will happen, for sure, to happen. Wearing time, 15 hours. Standard wearing time, I expect 10.5, maybe 11. And with Sjogren, I lower it all the time.
Do you recommend a break every day?
Regarding the break, they don't recommend it anymore.
Okay.
They want to learn the patients a technique where you fill scleral from saline from the top. I haven't tried it. I don't know, maybe I need someone to try it, because, and that's interesting, and you can try it yourself. If a patient comes with a scleral on it, and you remove it, the fitting after is totally different. Like totally different. So that was, for me, a good point as well. It could be because of your toric asymmetrical lenses, you put them on, and they don't find, and that's because the conjunctiva is on the scleral, and the conjunctiva is like my belly, you can push it in, and then it moves. The guy come to me, had a semisclera on it. Semisclera is corneal touch and outer touch, peripheral touch. We removed it, put on the sclera. It was fine in the middle, like the sagittal height was good. It was circling. Because the semisclera put a dent into his conjunctiva.
So I start early in the morning at first.
Yeah. Think about your fitting schedule and don't be shy. Stop, re-evaluate. I stopped the scleral lens fitting, put some soft lenses on it, and start the scleral lens fitting again sometime later. So how to remove? Never in the center. I always have my patients help me, and it didn't stuck because I put no saline on it. But since it was Julia's eyes, I didn't care. That's a nice picture. So, what are you? Because scleral lenses, I did not know, should I tell more about the fitting or just give you a general overview? My point is that you can just start. Just start where you are and try to evaluate from there. I think fitting specialty lenses leads to amazing contacts like Czech now, and even Shaka is enjoying it, working on it, because there's so many different patients and you can build a whole practice around it. It's possible. And at the seminars we do a lot more theory, but a lot more practice as well, because you learn with practice. I'm happy 3 patients that will come to Prague and we fit them. It's amazing for me. I will learn a lot of new stuff. And also, what I do is I fit your patients, you get the money from them, so the seminar is actually beneficial for you. For your shop. So, any questions? No? No questions? Wake up. So SwissLens has an amazing booth with cheese and wine and absinthe. But maybe start with the absinthe later.
I have one question.
Uh-oh.
When will the insurance pay for it? Also welche Voraussetzungen müssen da gegeben sein?
Das erkläre ich auch auf dem Seminar und das muss schon wieder schneiden. Nein. Ich kann ja mal so ein bisschen Werbung für mich selbst machen gerade. I read every document there is regarding insurance. I talk to every insurance how they want to have it. That's my job. That's my duty for the patient. They have to have keratoconus, and at a severe stage, they should have tried corneal lenses beforehand. When they have real Sicca, now I said it, I forgot the real, when they have Sicca, keratitis punctata superficialis, keratitis filiformis, any other immune system disease where they would benefit of sclerals. And then you have to know the numbers, you have to have a good price. I'm not the cheapest, but I'm not the highest. I give my price to the people I like, and then it's good. Then you charge it. And for all the German guys, I will do it in German as well. I do it digitally because actually you are obliged to do it digitally, but nobody knows. And then I fit a lot of sclerals. And insurance cover 90-95% of the cases. I write something, I get the doctor's paper, I get the patient's permission, I show them, I tell them what to expect, and I have the OCT, I have the pentacam, I have everything, and I don't tell them it will be the best thing ever made for you. It will be this. And then it works. And to get the insurance, you have to do the pre-qualification. And good luck with that. So, SwissLens is 25 years old. I like that they work on scleral lenses. Those are amazing lenses. They work for some patients really well, for other patients they don't work at all. You have to know a lot more about the eye, but you will learn a lot more about the eye. It's normal if you and look at consultations for Zika. Visit a doctor. Petra has her own clinic and check, and it's amazing to see how they work. It's really good. Good. Thank you for your time. All in English.